or was there a light bulb moment which pulled you into the world of surgery?
So this obesity is actually new to humans. Bariatric surgery helps people to get fitter, get better, get more healthier. It is a trigger for a whole lot of illnesses.
So when do you think someone should come to you for this weight loss journey? Do you think there is any right time or right weight?
సో లావ్ అయ్యే ముందే ఏదైనా చేసుకోవాలి కానీ ఒకసారి లావ్ అయిపోయిన తర్వాత వాళ్ళకి ఆప్షన్స్ తగ్గిపోతాయి. Now almost always bariatric surgery is done in minimally invasive, be it laparoscopic surgery or robotic surgery.
So welcome to the program, doctor, and really excited to have you here today.
Thank you.
So let's rewind a bit for us. What's your medical journey been like? I mean, was there a moment or was there a light bulb moment which pulled you into the world of surgery?
No, I don't know. I mean, I cannot place it, when I wanted to become a doctor. I think ever since I, wanted to be something, I wanted to be a surgeon. So I don't know. I mean, I'm the first doctor in the family, even in the extended family. So I really don't know how it started, but I love what I do and I'm happy that I've chosen this field.
So you always wanted to be a surgeon and you're here today.
Yes.
So we are here today to talk about an interesting topic, that is weight loss surgery or bariatric surgery. So what's driving this boom today, doctor?
I think weight gain, obesity. So this obesity is actually new to humans. You can say that. So for 99.9% of human journey on this planet, we've always been starving. Our stomach, our gut has been used to adjust to starvation. So a lot of time, a lot of history, humans have been eating one meal a day or at best 2-3 meals a week. Suddenly with a lot of comfort, with our Swiggies, with our Zomatos, with the junk food, the stomach is unable to take so much of calories. So suddenly there's a surplus of calories. So put it in statistical point of view, diabetes, which is rampant now, which is partly obesity driven. Back in 1857, when we had medical clinical data, only 2 cases were reported in the entire world. So now you have every household having a case of diabetes, right? So that's where the bariatric surgery comes into play. That's where bariatric surgery helps people to get fitter, get better, get more healthier.
So doctor, do you think it's fair to call obesity a disorder or a disease, or you think it's more complicated than that?
It's very difficult for people to understand that it's a disease. The reason I say that is it might not be a trigger for any particular illness per se, but it is a trigger for a whole lot of illnesses, be it cardiovascular disease. For example, again, I'll give some statistics here. So being obese, people who are morbidly obese have a 45% increase in chance of developing cardiovascular illnesses, have 30% increased mortality, have very high chances of sleep apnea, have 60% increase in osteoarthritis, have 50% chance of diabetes, hypertension, so on. I can keep naming everything, right? So fatty liver is very common thing. PCOD is another thing. Loss of fertility, loss of libido. These are very common in people who are obese.
So I think rightly, more than the cosmetic angle, I think being obese or overweight is affecting us in more than a way.
True. I think getting that point, psychological well-being is a big part of our life, right? Be it social acceptance, self-confidence, self-esteem, getting jobs. I think fitter people, good-looking people are more accepted in a lot of jobs. They get through in a lot of interviews. It's a well-known thing, right? So even psychological point of view, being obese doesn't help.
So doctor, for someone who's never looked into it or who never understood, what exactly is weight loss surgery or bariatric surgery? దీన్ని మీరు ఎలా ఎక్స్ప్లెయిన్ చేస్తారు?
సింపుల్ అండి. ఇప్పుడు బేరియాట్రిక్ సర్జరీలోనే మీనింగ్ ఉంది. సో ఇట్స్ బేసిక్లీ గ్రీక్ వర్డ్ అనమాట. బారో అంటే వెయిట్. సో ద రెస్ట్ ఆఫ్ ఇట్ ఇస్ సర్జరీ, హౌ టు లూజ్ వెయిట్. ఇంకా సింప్లిఫై చేయాలి అంటే వెయిట్ తగ్గడం అనేది చాలా కష్టం. వెయిట్ మెయింటైన్ చేసుకునేది చాలా ఈజీ. ఎగ్జాంపుల్ తీసుకోవాలంటే ఇప్పుడు 60 కేజీలు ఉండే పర్సన్ 60 కేజీల్లో మెయింటైన్ చేసుకోవడం చాలా ఈజీ. 60 నుంచి 55 రావడం చాలా కష్టం. సో దట్ ఈస్ బికాజ్ ఆ బాడీ జెనెటిక్ మేకప్ అట్లుంటదనమాట. సేమ్ వే ఇప్పుడు కొంచెం లావుగా ఉండేవాళ్ళు అంటే మార్బిడ్ ఒబేసిటీ ఉండేవాళ్ళు ప్రివెన్షన్ ఇస్ బెటర్ దాన్ క్యూర్ అంటుంటాం కదా మనం. సో లావ్ అయ్యే ముందే ఏదైనా చేసుకుంటే చేసుకోవాలి కానీ ఒకసారి లావ్ అయిపోయిన తర్వాత వాళ్ళకి ఆప్షన్స్ తగ్గిపోతాయి. సో వెయిట్ తగ్గాలి అని అనుకున్నా కానీ యూ హ్యావ్ టు సప్రెస్ హంగర్ అనమాట. అంటే ఆకలిని తగ్గించుకోవాలి. ఇప్పుడు ఆకలి తగ్గించుకోవాలంటే వన్ ఆఫ్ ద కోర్ బేసిక్ ఇన్స్టింక్ట్స్ విచ్ డ్రైవ్స్ హ్యూమన్స్ వచ్చేసి ఆకలి, ఫుడ్. యూ కెన్ డూ ఇట్ ఫర్ అ షార్ట్ టైం. కొన్ని రోజులు చేయగలుగుతారు, కొన్ని నెలలు చేయగలుగుతారు. దాని తర్వాత ఇట్ కమ్స్ బ్యాక్ విత్ ఎ వెంజెన్స్. సో అగైన్ దీంట్లో కూడా అగైన్ ఐ విల్ కోట్ సమ్ స్టాటిస్టిక్స్ ఎందుకంటే దిస్ ఇస్ బేస్డ్ ఆన్ సమ్ ఎవిడెన్స్. వెయిట్ లాస్ అంటే లైఫ్ స్టైల్ మోడిఫికేషన్స్ వల్ల వెయిట్ తగ్గించుకున్న వాళ్ళు 2 years తర్వాత ఎంతమంది ఉన్నారని చూసుకుంటే 96-97% ఆఫ్ దెమ్ ఫెయిల్. దట్ ఈస్ వై సర్జరీ అనేది ఆర్ అడిషనల్ హెల్ప్ అనేది వీళ్ళకి చాలా ఇంపార్టెంట్. పీపుల్ గో త్రూ లాట్ ఆఫ్ జడ్జ్మెంట్. వీళ్ళు ఈజీ వే తీసుకున్నారు. ఇట్స్ నాట్ ఎన్ ఈజీ వే అవుట్, ఇట్స్ ద వెరీ డిఫికల్ట్ వే అవుట్. జస్ట్ బికాస్ సర్జరీ చేయించుకున్నారు కదా అని తగ్గిపోరు వెయిట్. సర్జరీ చేసుకున్న తర్వాత కూడా సస్టైన్ ఎఫర్ట్ కావాలి. సో ఆ స్టిగ్మా నుంచి బయటకు వస్తే ఎంత తొందరగా పీపుల్ బయటికి రాగలుగుతారో దాట్ మచ్ ఫాస్టర్ దే కెన్ బికమ్ హెల్దియర్ అండ్ బెటర్.
సో డాక్టర్, చాలా మంది మీ దగ్గరకు వస్తూ ఉంటారు కదా ఫర్ దిస్ వెయిట్ లాస్ సర్జరీ. సో ఈ జనరల్ పర్సెప్షన్ ఎలా ఉందంటారు? ఐ మీన్, డూ దే లుక్ అట్ ఇట్ from the cosmetic angle, or do they come to you because of some general chronic issues that they've been having, or because someone else is pushing them?
All of the above. But most of the time it is because of some of the problems. The largest set of people మన దగ్గరకు వచ్చే వాళ్ళని తీసుకుంటే it is because of chronic illnesses అన్నమాట. ఎక్కువ మందికి స్లీప్ apnea ఉంటుంది. But they are at the tip అన్నమాట. Just a push away from cardiac disease or one of these things. So వీళ్ళు because they go for some doctor, knee pain అనో, high బ్లడ్ ప్రెషర్ అనో, డయాబెటీస్ కంట్రోల్ అవ్వడం లేదనో, మల్టిపుల్ షార్ట్స్ ఆఫ్ ఇన్సులిన్ తీసుకుంటున్నామనో, ఈ ప్రాబ్లం ఈ మధ్య ఎక్కువ వస్తుంది ఏంటంటే పీసీఓఎస్కి, పాలిసిస్టిక్ ఓవేరియన్ డిసీజ్ కానివ్వండి, ఇన్ఫర్టిలిటీ కానివ్వండి, వీటికి ఎక్కువ వస్తున్నారు ఫర్ కరెక్షన్ ఆఫ్ దట్. అండ్ అన్ఫార్చునేట్లీ లాట్ ఆఫ్ పీపుల్ డోంట్ వాంట్ టు సే దట్ వీవ్ అండర్గోన్ ఎ బేరియాట్రిక్ సర్జరీ బికాస్ ఆఫ్ ఫియర్ ఆఫ్ జడ్జ్మెంట్. That is changing for the good, but I think it needs to get better. I think awareness has to be created much more.
So when do you think someone should come to you for this weight loss journey? Do you think there is any right time or right weight?
Yes. So the simplest form of checking weight or health is BMI, body mass index antaru, which is based on weight and height, right? So ee BMI తీసుకుంటే anybody who is over 25 is considered overweight, and anybody over 30 is considered obese. It was rare at least 10 years back when we started off doing bariatric surgery. Over 40 అనేది it was rare. We used to think it is super obese. Now we see a lot of patients over 50 and over 60. So to put it into perspective, 60 BMI undali ante for a 6-foot person to have a BMI of 60, he should be 200 kgs. So, and it's not uncommon, trust me, it's not uncommon at all to see patients like that who walk into our OPs. Which patients actually need the surgery? Single straight answer is BMI of more than 35 with any of the comorbids, or BMI of more than 40 are the people who need the bariatric surgery ASAP.
So doctor, talking about bariatric surgery, I'm sure the surgery which is done today, it has come a long way. We are talking about robots, we are talking about laparoscopic. So what are the different types of surgeries, and how is it done?
Now almost always bariatric surgery is done in minimally invasive, be it laparoscopic surgery or robotic surgery. The advantage of minimally invasive is you have 3 or 4 small holes. You do the surgery. I mean, suppose the patient has a surgery today. Tomorrow evening he's fit to go home. So it's as simple as that. And the complication rates, the mortality, which is a big worry in a lot of articles in social medias, you see a lot of prominent people undergoing bariatric surgeries and dying. It's not so common. And in high volume centers like ours, the mortality is even lesser. It's 0.03%. It's safer than walking on the road.
ఇంకో కామన్ క్వశ్చన్ అడిగేది ఏంటంటే డాక్టర్, ఆఫ్టర్ సర్జరీ విల్ ఐ రీగెయిన్ ద వెయిట్ బ్యాక్?
Bariatric surgery is not a shortcut. It's not a magic bullet where you do the surgery and then you start miraculously losing weight, not doing anything. No, you have to still be very conscious of what you do, what you eat, and basic exercise is a must. Otherwise, you will put on weight, right? Although any bariatric surgery, your stomach is very small. It will hold probably 20% of what you can eat earlier. And there's a very common example I give a lot of patients. Suppose you can eat only 1 cup of food per day. You can choose what that is. You can have 1 cup of cereals, 1 cup of vegetables, salads, or you can have a cup of ice cream, right? So it's still a cup. So in the same way, your stomach, even though it's holding a very small portion, if you stuff it up with very high carbohydrate and energy rich food, you will put on weight.
So you still have to put the fries down and hit the gym.
Absolutely, Andy. Absolutely.
So doctor, how does the life change after bariatric surgery? Be it the food, exercise, or the mindset?
Almost all of them become better after bariatric surgery, be it psychological, be it physical, in the form of healthy lifestyle, in the form of their self-confidence, in the way they dress, the way they talk. People who come to our OP before the surgery who are very timid, shy, very less confidence, are completely different. They're transformed after the year. Imagine a person losing 20-30% of your body weight and then they're super fit. Again, the negatives of that would be you would not be eating as much as you would earlier, but in a way that's good because you can replace it with a healthier diet. You will have to stick to healthy lifestyles. There's no denying that. That's the only way to sustain a weight loss.
So what's your secret mantra to your fitness? I mean, do you follow any particular routine?
Clearly not. But I would love to follow a very regular eating habits if I can, and regular sleep and continuous exercise if I can.
So doctor, on a personal note, did you ever try these fat diets anytime in your life, be it the keto diet or the low carb diet or the OMAD diet?
I have tried intermittent fasting for some time. It did work. I've lost a couple of kilos, but it's practically impossible to follow. That's what I realized later on. So it's not sustainable, Andy. I mean, how can you live by eating one meal a day? Like I told you, this is the basic human. We have 3-4 basic instincts as humans, and this is a very strong feeling, the gut feeling, right? So you cannot get away from it.
So if you had to bust one myth about the bariatric surgery, what is that?
It is safe, and it is the only way to lose weight, sustainable way to lose weight. You can have short-term gimmicks, if I can call them, like your keto diet or your fasting, intermittent fasting, your high protein diet and all these things. Now the latest fad is drugs like Mounjaro and semaglutide. They are also very short term, right? The moment you stop the medications, you will put on weight. So the latest studies say they're better as an accessory to bariatric surgery, and they work better when used with bariatric surgery than used isolated in a single this thing. It's better for people to realize that this is the only way they are going to lose weight in the long term.
I was about to ask you the same. Now with the weight loss drugs in the market, do you think that would kind of create some sort of confusion in people's head if they should go for the drugs or if they should consider surgery?
People who have obesity, that's BMI over 30, it helps. Above 35, it doesn't really help so much. Above 40, it fades. Because you cannot keep it long term. The amount of weight loss is 10% of your excess weight that you lose after 12 months. And it's not like it's cheap or anything. It's pretty expensive. The medicine itself is pretty expensive. So how many people can actually do that, and how many years can they do that? As part of a diabetic medication, I think these are wonderful. For weight loss alone, I don't think. I think this is also a passing trend, like keto diet or any of these things.
And for someone who's thinking that bariatric surgery is an easy way out for them, what do you have to say?
There's no easy way out, unfortunately. So it's a difficult route. I think this is one thing I tell my patients who come to me for the first interview itself. So they're like, I want the bariatric surgery now. I tell them, I caution them that your lifestyle is going to change entirely. You will be able to eat smaller portions. You will have to work out. And you will have to work out. You will have to eat in moderation. You will have to keep a sustained lifestyle for a really long time.
And finally, what message you would like to give to our viewers out there on this topic, that is bariatric surgery?
Eat healthy, sleep well, drink plenty of fluids, eat a lot of fiber, and don't be shy of getting a bariatric surgery. It's not a quick fix. It is not a magic bullet. Nobody will judge you for getting it done. When you need it, you get it done.
So thank you, doctor. It was wonderful interacting with you today.
Thank you. Pleasure.
So this brings us to the end of this episode. Hope this episode was informative on the topic weight loss journey. If you or someone you love is considering about weight loss or bariatric surgery, don't hesitate to consult a specialist. Until next time, stay healthy and stay proactive. Thank you.